Hello and welcome everybody to another quick video. And in this one, I quickly want to talk about dental fissure sealants and how these fissure sealants can help prevent cavities or dental decay. So now I have this little two teeth model over here with me. One of these teeth has no fissure sealant applied to it. As you can see, this is a regular molar tooth. And the other tooth here adjacent to it, this one has fissure sealants placed, and you can see the chewing surface of this one is way smoother compared to this guy. So now let's focus first on this tooth right here, and the tooth that is virgin, as in it doesn't have any filling or any sealant placed on it. So when I use this dental instrument and run it on the chewing surface of this tooth, you can see that it seems to get caught in these pits and fissures, like so. You can hear the clicking. Now, these grooves are not inherently bad, but some people may have deeper than normal grooves or deeper than normal pits and fissures on their chewing surfaces of their molars, especially when kids around 12 years of age, when they have their second molars coming in, or they're turning 6 or 7. They have their first molars coming in. A good amount of kids may have grooves that are quite deep, and no matter how good of a brushing they do, as you can see here, I'm trying to brush these grooves out, you can see the bristles won't go all the way down to the very pit, down to the depth of the pit or the groove, and won't do an effective brushing, right? So now let's shift our attention to the adjacent tooth here, to this guy. And you can see this one has the fissure sealant placed. Fissure sealant is basically just a very thin composite resin material, kind of like filling material, that we sort of flow into the grooves, and then once it is flown through all of the grooves, we take out the excess using our instruments and then harden it by showing it a blue light that you may have seen at your dentist office. And when I compared this to the other one, when I run my instrument here, I can feel that this is totally smooth, a very smooth chewing surface as a result of the placement of the fissure sealant. So in a tooth such as this, it would be much easier to maintain this tooth by brushing the chewing surface like so. And you can imagine, because the chewing surface is so smooth and it is nice and shallow now, instead of having a deep pit like this adjacent tooth here, right? This tooth is nice and shallow. The occlusal, or the chewing surface of it, is nice and shallow. And there will be less chances of food getting caught here as compared to a tooth that has no fissure sealant placed. And in such teeth, there may be areas where the pit doesn't get cleaned out properly, and then that may lead to a spot of cavity or a decay, and that the dentist may need to drill a bit of the tooth, the soft decay out, and then fill it in the future. But in such a tooth where the fissure sealant has been placed, there are less chances of having chewing surface cavities. All right, everybody. So now when a dentist recommends a fissure sealant for you or your kid, you now know what they're talking about. If you found this video helpful and informative, please leave a comment, like, and subscribe. And I'll see you in the next video. Thank you. Hygienist out.